attention. I remember when I was a scout in my younger days, right? Whenever they wanted to get attention, they would really shout, "Attention!" Now, what's the problem nowadays? There's so many distractions we all have in life, including your patients, including your team members, that they're losing attention, they're losing interest, they're losing focus on what you have to say. There's something called currency, right? Attention is the new currency. You must have heard about that. And Jim Rohn used to say one of the greatest gifts you can give someone is the gift of your attention. Yet nowadays people are losing attention faster than a bullet. They're losing interest, they're losing focus, and as you may speak and continue speaking, their minds have wandered off. Have you even felt that? Sometimes you kind of feel that you're talking and you're wondering, is this guy or girl even paying attention? Is my patient even paying attention? So this happens during our consultations too. So what I wanted to do today is share with you 4 types of poor communicators. And if you recognize that you have one of these traits or habits, get rid of them and start paying people and start getting people to pay more attention to what you have to say. So the number one, the backspace button presses. And what I mean by that is, have you ever written notes of a patient or even an email to a patient and then you've gone backspaced and then come up with something new and back, come up with something new? So what happens is some of these poor communicators, and this might be one of your traits also, is that you say something and then you rewind back and say something and then you rewind back. Now, these may work well on a computer or an email because always we can backspace it, no one can know. But when you're speaking, it can cause frustration to the other listener. I mean, think about this, right? What if I was say, listen, I'm going to go to work. Well, I was going to go to work, but I was passing by home first. But then I was passing by home and I was driving. Well, I wasn't driving, but my friend was driving. Like you're all over the place. You're continuously backspacing when you're speaking. So this is one of a trait where you can really cause frustration in your listeners. So watch out and try not to backspace in your communication. Number two, what we call the miniature lovers, right? The miniature lovers, or what we call the minutiae. Minutiae basically means many dentists get caught up in these micro details or the minutiae of certain procedures. Now, most of your patients don't want to know how something came about. When was root canal invented? When was implants invented? What's an implant made of? Most of your patients don't want to do that, and yet you are sitting there explaining them in every depth of the procedure. This can once again get your patients to lose focus, lose interest, lose attention in what you are saying. So keep it simple, guys. Keep it simple. Number three, what we call the expounders, right? The expounders. The expounders basically means that you're mentioning the same point over and over and over again. Repeating one thing over can lead to what we call rejection, right? Now, this may work in teaching someone something new, or in a seminar that or you're trying to drive a point home. But doing this with your patients over and over is not ideal. So once again, mentioning the same point over and over again is not needed. Just the way I just did it, over and over again. Not needed, right? Right. Number four, what we call the cliche champs. This is another way of a sign or a trait of a poor communicator, right? And where people will lose interest. Now, there are a lot of people and even dentists who abuse cliches. And in the world, cliches such as like, I'm a dentist and I'm also an artist. Now, come on, everyone has heard that. Stop using that kind of cliches every time. Or things like, oh, we don't just consider your teeth, we consider you as the whole person. That's old school nowadays. You need to kind of stop using these typical cliches. So be very careful of the kind of cliches you're using nowadays. Not the stock standard ones. Learn some new ones, because if you keep using the standard cliche ones, you can lose credibility very faster. So there you go, guys. The 4 type of poor communicators, or the 4 type of traits which can lead you to become a poor communicator. What I advise you to do is just go once over this recording, and point out where do you guys, or where do you individually need to work on. And that's all for today, guys. I hope that was of value. If you did like it, do please share, comment, and like. Open to any kind of discussions. Take care, guys, and have a lovely magic weekend.